As you know, there are probably about 500,000 workers in the operating room that are exposed to surgical smoke 5 days a week or more, depending upon how much overtime you guys work. But it covers not only the surgeons and the perioperative nurses, but the anesthesia group, as well as the patients themselves, especially if they don't undergo general anesthesia with endotracheal intubation. Smoke has many components to it. The ones that we are very familiar with, of course, includes vapor, about 85% when electrosurgical devices are used, as much as 95% when lasers are used. They contain blood elements, viruses such as HPV, and today, of course, we always think about HPV and adenocarcinoma of the nasopharynx. No longer can that be hidden under a cloud of smoke, if you'll forgive the pun. And many chemicals, as many as 600 chemicals. A number of these have been considered mutagenic and carcinogenic by NIOSH, and they include chemicals such as hydrogen cyanide, benzene, carbon monoxide, methane, and formaldehyde. As a matter of fact, when you compare the smoke in an operating room with cigarette smoke, there really is no difference because they all represent the breakdown of an organic carbon-based compound, whether it's the human tissue, which is carbon-based, or whether it's vegetable, it's still the same. The only difference between the two really is the presence of nicotine in smoke. And there we're talking about a number of different things because first we talk about the gas effect on our own system versus the effect of nicotine specifically on the vascular system. The hazards of surgical smoke are multiple. The simplest one, of course, is the odor, which can cause nausea and just a sense of discomfort from it. And the sizes of the particulate matters, as we now recognize that over 80%, or approximately 80% of surgical smoke, really represents nanoparticles. That is to say, anything less than 1/10 of a micron, or 100 nanometers in size. This is a picture of a virus, and you can see the sizes. When we compare the sizes, the important thing to recognize is that the mask that you use does not protect you from inhaling any of these particular materials. Whether it's viruses that are very, very small, a couple of maybe 100 to 200 nanometers in size, less than 100 nanometers in size, versus mycobacteria, which is about 500 nanometers in size. Again, this slide is being shown to point out the components of surgical smoke and the importance of trying to avoid chemicals that are known to be carcinogenic and or mutagenic. The tissue particles themselves are either in the form of aerosols, such as bone dust that we see in orthopedic procedures, or other aerosol concentrations that grow by adding on. Also, the word that is used is accretion, where they get bigger and bigger in size. And then we have the concentration, which are the ones we're really concerned about, the ultrafine particles, which are another way of saying nanoparticles.